There is creeping complacency right through to full-blown complacency when it comes to COVID. I think a lot of people are still reeling from the trauma of their experiences over the past few years. How do you get, I guess to put it crudely, people to give a shit?
Look, it's a really important point, and we know with public health interventions, it's people's perception of risk that really dictates whether they're going to do something, change their behaviour, adopt a mitigation strategy, for example. And I think for the majority of the population, that perception of risk has declined to levels that don't really give enough respect to this virus and the fact that it's still around and still causing people to end up in hospital and not survive. So it's a really important point. I think we need to do better at communicating that risk. And, I think the challenge has been we maybe overdid it for a period of time early, and that did lead to some fatigue and saturation, and so some people turned off from some of that messaging, and then I think we've underdone it in more recent times. We've stopped reporting numbers, we've stopped giving some of those basics of the public health messaging and some education around how we can intervene. So I think it's about getting the right messaging to the right people, and I think that has to be a really active process of letting people know COVID hasn't gone away. It's increased in terms of risk at the moment, but we have fantastic tools to address it, but if we don't utilise those, then the impact will be far greater than it needs to be.